Can you turn the brightness here up all the way? Hi, it's Dr. Buford. We're just getting started on your right shoulder. We're looking in from the back to the front. Everything that you see on this box, everything, and turn the whole thing so it's facing us. Everything that you see is magnified 30 or 40 times on the screen. So right now we're just getting our first look inside the joint. We can see some torn areas around the biceps anchor, which is why we're going to be working on the biceps today. We can see some cartilage injuries here. We can see a little bit of fraying in the rotator cuff also. And then as we look around the socket, we can see you've got some pretty significant arthritic change. You can see there's loss of cartilage here. Pause, please. Okay, so these are the areas where there's some can you, I'm sorry, could you take this whole tower and just swivel it towards us a little bit more? Okay, go ahead, record. Okay, so here's the areas where you've got some pretty significant arthritis. We can see some fraying. And really, more importantly, we can see loss of cartilage here. I'm seeing just raw bone down below. And the only good bit about that, especially since you're so young, is that we've had lots of patients with a lot of arthritis in their shoulders that do okay because we don't walk on our shoulders. If you had this amount of arthritis in your knee at your age, that would be a much bigger problem because it would probably be hurting you a lot more even. So we're going to make sure there's no loose areas. Okay, I'm not getting anything else loose, so that's good. But there's just a lot of arthritic change, though. Okay, let's come on back over here to the left. And then we're going to look up at the rotator cuff because that's torn also. We weren't expecting that, and it may not be a complete tear, but right here we can see it's at least partially torn on the under surface here. So we'll take a marker stitch and mark this area here. If that's the only injury you have to the cuff, we'll probably leave that alone. But we're going to put a side-to-side right where it's split there. Okay, let's look at the biceps. We're going to go ahead and release the biceps now. And the way that we're going to do that is we're going to take a pair of scissors here in just a second. And actually, we're just going to clip it. Look down the front for me. Okay, pause please. Okay, so we've released the biceps and we've placed this stitch. You can see it there going across the split in the rotator cuff. As we pull tight, you can see how that's going to seal that over. We're still going to have to take a look on the other side to make sure that that tendon is okay and doesn't need anything more to fix it. But at least for right now, that looks pretty good. Fully released, isn't it? Push in and look up. Yeah. Okay, so we'll go off on the video. We're going to get to work up above. Pause, please. Okay, we're just cutting the sutures from the rotator cuff. And you can see the instrument there that cuts the suture tails. The reason why we're not having to do more is because on this side the rotator cuff looks good. You can see there's some redness in it, but there's additional tearing, so that's good news. So we're done here. We've already taken off the bone spur. You can see how this is nice and flat at the top of the screen. And there's really nothing else to worry about up here. So we're going to go ahead and get to work on the biceps tendon. This will be the end of the videotape. I really hope this... Good luck to you now. Bye-bye. Pause.